Welcome, everybody, to this first webinar dedicated to SibUS, safe injection by ultrasound, our technology. It's a great pleasure for me that you are connected. We are going to speak about the appetence in our profession for the ultrasound-guided injection. Great pleasure to share with you data dedicated to this technology. So I think it will work. Yes. So we are now on this new area. We was at the beginning more than 10 years dedicated to a reaction against a very growing problem in our profession concerning mainly the ischemic or vascular problem dedicated to the filler. But of course, this technology will just go back to that, and you know better than me, is going to be a very interesting technology as well for the toxin injection and the thread treatment. But last but not least, I think it's not just good to say just mentioned, but we discover, and I hope that you will discover with this SibUS, that it gives you a new area for your injection concerning the work precision, the accuracy when you inject. It's important to understand where we are. And as you can see, the global statistic with a very smart reference say that we are about 253,000 physicians, but it excludes the HCPS, the physician extender. We are on a very growing expansion. And that gives, of course, some important data we need to analyze concerning the following. The following is that more and more we are in front of a very serious problem. Concerning just the physician, you can see that the number of vascular compromise, of course, we are not going to give any time a real necrosis or a blindness, is about 100,000 for this population of 400,000, 500,000 worldwide injector, with a real problem. And very surprising is the fact that now we have this risk of blindness, and thanks to Stella Dzaknikova, I would like to mention as a very brilliant expert dedicated to ultrasound-guided injections from Seattle. And as you can see, is to see what we can do, dedicate to the fact that there are, before the employment of the ultrasonic guidance, there are not so many solutions. Of course, we can speak about many interesting MRI, but it's not so easy to send the people to the MRI and then to use this sort of practice on a daily practice. So if we go step by step and on a very accurate analyze, the ultrasound guidance is absolutely the best way to go to now the interesting improvement concerning the safety. We have a very growing interest concerning our segment dedicated to the fact that we publish a lot, many articles, and that's, as you can see, the book. And just would like to mention the Fascial Ultrasound in Aesthetic Medicine recent book. I had the pleasure to participate with Peter Veltwitz and many key contributors. And I would like to encourage you to publish and to read. And now we know that during the Congress, the interest is big. So there is another point, and that's a very interesting point. is that, and the company are not so keen now to analyze that point, but they need to know that more and more we are going to be on a legal necessity to have the use of ultrasound guidance register to prove that we have done that probably on the coming years dedicated to the face. For the moment, it's just a law, but it is a law in both sides of the Atlantic, meaning UK and United States. And in Florida, you are absolutely obliged to make this documentation before your fat grafting dedicated to the BBL. And we'll go back to that with Sebastien Garson concerning his lecture. So I think it's very important that you understand that it's become to be mandatory, and our estimation is that it will be step by step on the field of the face. Of course, we have now a certain number of good products who can give you a good level of analyze concerning the botulinum toxin different location you need to inject. It's good concerning the different layer you would like to put your product, could be the toxin, could be the filler. Concerning the detail of the anatomy, the vision of the ultrasonic anatomy is great, and you can detect the different variation. And that's the key point, because could you imagine that we have inject during 50 years anytime on a daily practice without the real vision of what we are doing concerning our injections? And we can, of course, make the detection of the pre-existing product. So I think it's quite interesting to mention that, of course, a certain number of devices was quite interesting, but they're a little bit bulky, heavy. We'll speak just in a while about the fact that the linear probe are not the best one concerning the concavity and the convexity of the surface, and it's block one of your hand. So in my opinion, when you have the hand with block, is not so easy to play with. So let's discover the game changer. And I'm happy, of course, to present you now this very important cohort of high-level speaker. So after me, Audrey Melin, very promising young dermatologist, will speak about the atlas of dedicated position. Then I will make the demonstration for video of filler injections with video concerning the SibUS technology. Then we are going to have Sebastien Garson, who is going to demonstrate how it's interesting in surgery for the fat grafting and many body indication. And then Mauricio Ceron from Germany, a general surgeon. Sebastien Garson is a plastic surgeon, past president of the French Society. And Mauricio Ceron will speak about the demonstration with video of toxin injection concerning SibUS, and he will finish by the key point, selecting ultrasound-guided injection device. So, and Hugues Cartier, our actual president with director, I am the president, but the director of IMCAS, actually concerning the program, Sebastien and Hugues Cartier will be with us, and Hugues Cartier will comment his huge experience now with SibUS. And of course, I will finish by some important news. You need to understand that we are going to organize in Paris a very interesting class, May 24. Put immediately in your agenda the May 24 in Paris, and you will be training on this technology. So it's the moment now to welcome Audrey Melin, who is going to present you this atlas of dedicated position.
So, hi everyone, my name is Audrey Melin. I'm thrilled to present you today in the SibUS method, the Atlas of Dedicated Position. Because as ultrasound is becoming increasingly integrated into aesthetic medicine, one of the most common questions we hear isn't just how to use a SibUS, but how to position yourself in order to use it with confidence, precision, and ease. So today I'm excited to share with you one key element that will determine the success of your SibUS-guided injections, which is your position. Not just where the probe sits, but how you sit, move, and align everything from your screen to your hands to your eyes. So we'll go through the essential ergonomic principles, tips for optimal posture, and small adjustments that will make a big difference into your daily practice, so that when you try SibUS yourself, it already feels natural. So let's start with something we don't emphasize enough in ultrasound-guided injections, which is ergonomics. It's not just about how to place the probe or how to operate the app. It's about how to position your body. Because if your wrist is tense, if your spine twisted, if the screen is off to the side, your image will become harder to interpret, your gestures will become awkward, and over time, fatigue or even injuries can set in. So this is why SibUS methods include an atlas of position, not just for the probe, but for your whole posture. Your chair, your hand, the screen, and the patient. The goal is really simple, just to create natural ergonomic flow where you can inject safely, visualize clearly, and protect your body. Because this is something you're going to do hundreds of times a month, and small adjustments will definitely make a huge difference. So how do we set up good posture? First, keep your wrist and elbow relaxed. Your wrist should float gently, never pressed or locked. Your non-injecting hand, the one wearing the SibUS, should always have a stable point of contact. This will ground your movement and give you better control over the injection. So you should always look for the most comfortable hand position. Don't hesitate to rest gently on the patient. It's perfectly fine to support your fingers, the lateral side of your hand, or even your forearm on the face or the chest of the patient. Then you want your visual line, a straight visual line. You want a straight, natural connection between your eyes, your hands, and the screen. So you need to place the screen either at the head of the patient or on the side, depending on your preferences and also on your room setup. So if you find yourself twisting your neck, you need to stop, adjust the screen placement and not your posture. Finally, think about your spine and your shoulders. Keep your spine natural and avoid raising one shoulder. To do so, you can ask the patient to turn the head or the body to give you better access. You can also lower the head of the chair so the patient is more reclined. Because when you use SibUS, you often wrap your scanning arm around the patient head in order to position the probe opposite to the cannula entry point. And if the patient is sitting too upright, this will forces you to lift your shoulder, especially when injecting the contralateral side. So this is where fatigue can set in. Having one shoulder constantly raised will disrupt your symmetry and comfort. So the key is really simple. Just lower the patient's head, recline the chair, and bring the body in a more horizontal position. This will allow your shoulders to remain at level and your posture to stay natural. So no tension, no strain, and no compensation. So these are small changes that will make a big difference in a daily comfort. So now let's look at how to position your body around the patient. You have two main strategies. Option one, stay on one side. You place the screen at the opposite side to keep your visual line straight. This method will minimize your own movement and keep your cable setup really simple. You almost don't move. Option two, you move around the patient. This is more dynamic and you change sides depending on the injection sites. So you place the SibUS probe and screen at the head of the patient to do so. And when you switch sides, you need to always pass behind the head to avoid twisting or pulling the cable. This method is more dynamic, and the advantage is that the patient doesn't need to move. You adapt instead. So both strategies work really well. You just need to choose the one that fits your habit and your room layout better. So the goal stays always the same: visual alignment, ergonomic postures, and minimal strain for both you and the patient. So once your body is in the right posture, let's talk about the probe itself. There are three main ways to position SibUS during an injection. Option one, in line with the cannula. So this will help you follow the path of your injection. Option two, opposite to the entry point. This will allow you to watch your cannula tip advance. And finally, perpendicular to the cannula or needle, of course, to see exactly where it's the end of the cannula or the needle and its and the tissue that is surrounding it. So all three options are valid. You just need to choose the one that works best based on your preferences and on the injection zone. So now let's look at some practical example of how to position yourself with SibUS in real clinical scenarios. So we'll begin with toxin injections because they are often the easiest place to start. The great thing is, in most cases, neither your position nor the patient's position needs to change. So you can use SibUS exactly as you would during a standard toxin injection. Same gestures, same ergonomics. For instance, when treating the corrugator muscle, you can place the SibUS parallel to the muscle fibers, then gently lift the muscle away from the orbital arcade, using either your thumb or your third finger. This will give you both the visibility and depth control for safe, precise, and toxin delivery. Here, for example, you can see how the probe is positioned during a typical injection of the procedures. You just observe the hand posture and how naturally it integrates into the movements. So these next image show real examples. So please pay attention to the angle of the probe and how it follows your usual injection line. You almost don't change anything. So what about hyaluronic acid injection? Well, when injecting, you have two ergonomic options. As we started to say earlier, you can either stay on the same side, typically on the right side, if you're right-handed, and ask the patient to rotate the head. The chariot will be placed at the left side of the patient in this scenario. So for injecting the patient right side, a slight turn to the left is usually enough, as you would do without using ultrasound. For injecting the patient left side, you need to ask for the patient to turn the head and sometimes even the upper body, most significantly towards the right, so they can present the left side fully. This will give you the best access and keep your posture neutral. Or you can move around the patient, facing each side directly. But in that case, the patient remains neutral and you adapt your own position. The chariot to do so is placed at the head of the patient, and when you move, you just need to pass behind the patient's head. In both cases, you can place the probe in line with the cannula, opposite or perpendicular. This simple principle is really easy to be applied and can be applied in all the zones. So let's apply them to hyaluronic acid injection so you can see. So for example, for treating the tear trough. Here is an example of how SibUS integrates really seamlessly into a tear trough injection. Notice the alignment between the probe and the cannula, whether the probe is perpendicular or in line with the cannula. So for the nebulized fold, we follow the same ergonomic principles as for the tear trough. So you can either stay on the same side and ask the patient to rotate the head and body accordingly, or move around the patient depending on your preferences and on the room setup. The probe can be placed either in line or opposite to the cannula based on what gives you the best visibility and control. So what about mid-face? Well, for mid-face injection, as always, either stay on one side and ask the patient to rotate the head and torso or move around the table. Place the probe either in line or perpendicular or opposite to the cannula or needle, depending on which gives you the best visibility and comfort. This time, for example, with the probe in line with the cannula. So please observe how the hand holds remain natural and stable with good support and clear visual line, whether it's perpendicular or opposite or in line with the cannula. So as mentioned, for mandibular line, masseter, and chin injection, it's always the same principle, either stay on one side or rotate around the patients. The proposition is, as always, the same. So in the chin and in the mandibular area, position remains intuitive. What changing slightly is your hand support and angulation sometimes. So you can see here for this type of injection, you can either place it in line, opposite, or perpendicular, depending on what you prefer and how you see the most clearly during the injection. The same thing for the chin, either with a needle or with a cannula. Lastly, for the temple region, same approach again. Fixed position or moving around, depending on your preference. Choose a proposition that offers the best view of your cannula pass. The propositioning follows the same principle. It's all about finding the best angle for a comfortable injection. Here is the last example, and you can see for the temple injection, only the patient moves. My hands actually stay exactly the same, and just the patient will rotate his upper body and torso just to the right, so he can give me full access to the left side. So it's really easy to integrate. So here are the key takeaways for a comfortable and confident use of SibUS. First, your position comes first before the device. It's a really easy to use device, so it will really seamlessly integrate into your daily injection. You can follow simple, repeatable ergonomic setups. Either stay on one side or move around the patient, and the chariot position will just depend on that. If you stay on one side, you put the chariot at the opposite side, and if you prefer to move around the patient, you can put the chariot and the screen at the head of the patient. You can ask for the patient to move its posture to avoid fatigue for you, since you are doing repeated type of injections. You can choose a probe and the probe position depending on on the side that you will inject and on how you will see the cannula move. So with the right positioning, SibUS will become a second nature, and it will be really easy to integrate it in your day-to-day practice. So thank you very much. If you have any questions, please don't hesitate.
Great, Audrey. Many thanks. I think it was very, very easy to understand that, of course, we need a learning curve, but it's not a so big learning curve. And that's something is now very recognized. At the beginning, and Sebastien will comment that point. Sebastien just arrived from the surgery. You can see that he didn't make some nice vision about the hair, but he just came from the OR, and he will comment this point. And please, guys, we have more than 200 person colleagues. We are connected. We need your questions. So as you can see on the Zoom, you have the key and R, and you can go to the key and R and ask everything you would like that we begin to debate with you. And we can speak now, we can speak later, but please, we need your question. So Sebastien, what do you think about the learning curve? Is it a big learning curve, or is it something which seems to be not so big following what we know now?
So hello, everybody. Good to see you. And hello, Benjamin. Yes, learning curve.
I present you before, so I have just to mention that we are so happy to have you. I will be on the plane for Sao Paulo tomorrow, and you will be on the plane for Sao Paulo after tomorrow, ready for IMCA Sao Paulo.
On Thursday.
Sebastien is one of the co-directors now of the program. So please, Sebastien.
Okay. No, I think we are doctors first, so we have some knowledge about anatomy. I encourage everybody to go back to the anatomy book, go some course on anatomy if they can, the opportunity to go to the lab. It's fantastic because they will get the opportunity to realize what they see in gray with the ultrasound and comparing with the real anatomy. Doing so, the learning curve will be much more easier to do and quicker to achieve. The funny thing with ultrasound, it's a probe. You can use it at home. You can use it on yourself. So you can spend a lot of time on your anatomy, and it's really easy. You don't need a patient. You can do it on your face, on your arm, on your stomach, what else? And it's easy to understand how it works. And the other thing is the ultrasound exam is a dynamic exam. So
Correct.
it's really interesting because it's a live exam. So if you are not you don't know really where you are, you just contract the zone. You will see the muscle able to move. So doing so step by step, you will be better and better in terms of reading what you are looking through the screen, even it's gray.
Perfect. So one more time, please, during all this lecture, if you have any question, don't hesitate. We are ready to chat with you and to debate about your question. So let's go now to the second lecture from my side, dedicated to the demonstration with some video concerning the filler injections. And we are going to speak a little bit about the specificity of the device. So as you can see now, the problem was that we need to have that on the top of our finger. So we need to make some nice miniaturization and make something with only 15 grams. So 15 grams, as you know, is nothing if you compare to the 500 grams to the competitor, and it's totally small if you compare the length of the linear, the curvular, and the OK probe. They are much more big, and there are some problem we are going to comment just in a while. So let me just begin by Hugues Cartier.
This is a game changer in the field of aesthetic. This probe, his name is SibUS. SibUS is safe injection by ultrasound. You can see here in the glabellar zone, the muscle procerus. Can you contract the muscle, please? And you will see the muscle is bucking. Near the chin, you will see the DLI, the DAO, and if you want, the chin, the mentalis muscle deep in contact to the bone. To look at the fascial channel, you see it's easy to see. You see immediately where you are with a branch on the fascial artery, and you can follow easy here, just below the skin. I want to inject in the pair from space. I apply my probes to see the vessels, dips, nothing, just a contact to the bone. I introduce my needle, contact to the bone.
So look at that. I think it's very interesting that you can understand that for the first time, we can control exactly where we are, because if we employ a linear probe, we need to enter from this point to attend this point, with not exactly what is the most easiest one.
I inject and you will see the bubble, the anechoic, immediately, just below the vessel.
Mauricio will speak about these corrugator injections just in few minutes. We can welcome Mauricio now.
Now you can see the tip of my cannula, so I can inject deeply the volume I want, and I see exactly the volume I put deeply is very precise, is secure with the eco-guiding method.
So let's begin by the temple, and I think it's a very good first location to chat with you concerning what's the technique and the beauty of what we are doing. So as we can see, we have all the layers to estimate, and you can see now that your brain begins step by step to have some habit to analyze the skin, the superficial fat compartment, the fascia. We are going to back to the fascia, the deep fat, and of course the muscle, and then of course the bone. So it's quite easy to go step by step. And on this video, we have now the vision of the arteria. That's the temporalis arteria. So you can see how step by step it's clear for you in your brain. And let's go now to discover the technique. So you can see here the superficial injection. That's the cannula. You can see here the cannula. And we are on the superficial fat compartment, the layer 3 of this sort of injection with, of course, we recommend. But for the first time, we can see exactly what we are doing. And that's the second injection on the interfacial layer. And that's exactly the layer you can see now between the two fascia. And that's something we make sense. But could you imagine that before we have only to imagine where we are? We never saw exactly where we are. And let me just mention one of our very key investigator, Won Lee from Korea. And as you can see, he was injecting on a different axe, but it's quite interesting to mention, of course, our contributor. Concerning the forehead, it's the same. We have, as you can see here, thanks to Professor Inji Kim, another important contributor to SibUS, to see where is exactly the supratrochlear arteria, and you can see how it's clear, and we can detect any variation. And the same concerning another important contributor from Korea. You can see that we have many contributors from Korea, Dr. Kyo Yi. We are now 2 articles in SibUS-In press. We can detect the supratrochlear artery. And now let's go to the cutaneous team with Dr. Velthuis and Dr. Schelke, and the same. They make a detection of the supratrochlear artery before any injections. And that's something, of course, will make sense. And the injection, you can see now, is much more superficial. It's on the deep fat compartment. Now let's go to the nasolabial fold, and we are going to have the same sort of detection. One more time, when we were injecting previously, it was impossible to see exactly where is the fascial arteria. And you will see many variations. So let's begin by this first observation from Mauricio Ceron. So you can see that the arteria is on an intermediate positioning, I would say close to the SMAS between the two fat compartments. In this location now, from Audrey Melin, you can see that the arteria is very deep, close to the bone. So if you go perpendicularly directly to the piriform sinus, you can see the problem. So I don't recommend you, of course, to employ the deep injection in that case. It's not the same concerning this location. You can see that the fascial arteria is much more up, I would say, on a medium positioning, just that we mentioned. And I think it's important anytime to make a mapping where you are, and then, of course, to inject and concerning the guidance. And the same here for Leonie, who is going to make the piriform sinus injections. And you can see that the arteria, I would say, is a little bit on the intermediate layer, not so close to the bone, not so close to the surface. So I think it's quite important one more time that your eyes begin to be custom. That let's go to the jugomalar area, and you can see now the same sort of assessment. So if we go to Sebastien, and Sebastien will go back to that, let me insist a little bit about this very smart iconography. Number one, look at the finger. It stabilizes the positioning of the ultrasound probe by the other finger, like a pyramid, you know, and it can palpate the cheek. We never happen when your hands is blocked. One more time, it's not so easy to palpate, of course. And you can see here, of course, the cannula, and that's something with very interesting. Let's go to the mapping of Kyo-E, and you can see now the infraorbital artery and the foramen. And now we go to Hugues Cartier with this infraorbital artery detection. And you can see now that the location is a little bit quite okay, but important to know exactly where you are. Now let's go to the second layer. And you can see now that a little bit down on the marionette line, we have the detection of the fascial arteria. And one more time, it's the first time. For the lips, the same. You know, we have big arteria, the coronary superior arteria, the inferior coronary arteria. They are very big. And we know that there are many variations. And we know, look at this article, that we have minimum 5 main variations to explore. So it's important that you understand that anytime we have variation. Concerning the chin and the oval, it's quite important to go to the same way. So look at this wonderful mapping concerning E.G. Kim, and you can see now how he has the vision of the inferior labili arteria, which is quite interesting. The same concerning Dr. Kiyo Yi, who makes some injection on the chin with the cannula. And if we go now to the mandible to go a little bit more quick, because we have other important speech which is going to follow. So concerning the mandibular angle, you can see now how we detect the vision of the cannula. With here, you can see the movement of the cannula and know exactly that we are on the right layer and, of course, outside of the parotid, which is very important, as you can imagine. So this technology, and that's the new one we would like to that you begin to exercise. It's all-in-one, and Mauricio can speak about this machine just in a while because he has actually in Hamburg this machine. And as you can see, it's a real-time imaging. It's high precision image. It's a multiple image mode with the B mode, the Doppler, and many other if you would like to employ. And it's a very easy way to capture and save the image. And of course, it's a medico-legal point that we would like to suggest from you. And we have the 2 other versions, the trolley version and the portable version I will bring in Sao Paulo for the class. And this portable version, like the other, good has all the preset mode, will cover all fascia and abdominal area. It's a comprehensive measurement and calculation package, and it integrates the procedural guidelines. And thanks to the cord, we maintain the cord design because the wireless, it's not stable. Pay attention at that. You could have some problem with the wireless. That's the reason, the main part of the big company, they maintain the cord. So that's the all-in-one. And I'm sure that Sebastien will speak about this rotation of this big screen, the 23-inch, because it's a very smart vision about the 7 centimeter of the abdomen and the body. And as you can see, it's adapted to all nail for the woman, you know, and we have this elegant bracelet now called to the Apple Watch bracelet, and we have different size of finger, of tips. And last but not least, we have echographic cannula. Look at that, echographic cannula 25G, and we are going to share with you as a very key point, this echographic 30 gauge needle is going to be a very interesting point. So we are in development concerning, of course, the Gen 2, dedicated to the color machine, the AI, the motion gesture, the voice control, and the stable wireless. Everything will be in development. And I would like just to mention that we are going to have some exploration in other applications. We are a little bit more mature in this ultra-guide injection technology, like, of course, not only the fat grafting in our side, but the rheumatology, the pain treatment, and many others. So I think it's my time, and I would like now to ask Mauricio and Sebastien, what do you think concerning the fact that for the filler, it's going to be a good level of improvement? What is your vision? I know Mauricio will speak about the muscle that dedicated to the filler. What is your sensation? What do you think about this new technology?
Well, in general, regarding filler, but first of all, thank you so much for the invitation to be part of this
I present you previously.
Okay.
Mauricio is a fantastic general surgeon from Hamburg and dedicate now to all development concerning EBD and also injectables. And he's a key guy concerning ultrasound-guided injection.
Yes. Well, thank you so much, Benjamin. So what I really enjoy about this new machine is that because it's kind of curved, you can really reach different areas of the face that maybe are deeper or they are curved as well. So sometimes it is a little bit more difficult to reach those areas with the linear probe. And this curved probe adapts, for example, for the piriform space, very nice. Even for people with very depleted temples, actually any concavity or convexity in the face, it's nice to be seen with this. And of course, we have great implementation of different cannulas and needles that are very nice visible in order to be more precise when we inject fillers to the face or even approach facial muscles with toxins, which is something pretty interesting and what I'm going to be talking about. But now, Sebastien, I give the word on you. What is your point? What are your thoughts on this?
Yes. What is your feeling, Sebastien?
No, it's quite interesting. Since the beginning, the idea was to do not change so much the way of you are practicing, because most of the doctors or surgeons, they have some habit. They know how to inject anyway. So it's a new tool, it's a game changer for sure. But the idea was not to do something too much different and change completely the way you are doing well already. And the deal was to doing better, more safer, and don't be too much time consuming also in your practice, because most of the colleagues are very smart. They do very good timing. They are very accurate injection points. So by the way, we won't learn them how to do it, but even for me, in some dedicated area of the face, for sure, that's some tricky safety zone we have to look on. And when you are looking on with the Doppler mode, for sure, you pay attention on things you won't see. And so when you start to see the problem, for sure, you will step down a little bit. You slow down your injection, you slow down your cannula, you slow down your needle, and it's better at the end for you and for your patient. So the idea was to try for everybody to test it. So come to the course, test it, and step by step, we find the good balance in your practice when I use the ultrasound for the injection. Is it for mapping? Is it for a control injection? Is it post-injection control? There's many ways to adapt your habit, and this is, in my opinion, the most important. But for sure, for example, for piriform, piriform is kind of easy way to go in and correct it. But when you put the probe in, you pay attention. There's a lot of vessel in, and sometimes the interesting thing is sometimes you are safe. Okay, you feel like every day and you are far from the vessel, and sometimes you put the probe in the zone and even you are thinking you are safe, the vessel are very, very close too. So I think it's a good habit to deal with, but the very goal best standard for me is to treat it complication so far, because you're able to target the zone where the HA, if it's HA for sure, what the HA is involved in the problem of bruising, big face, what else? So you're able to target your hyaluronidase, which we know is kind of expensive drug, and you just put the right amount of HA in the place you need to put it. So you don't waste your product. So you earn money so far because you don't waste money trying to get hyaluronidase around the zone and pray to get some effect at all. Doing with ultrasound is much more accurate, and doing so, it's easy because you just target, you get the answer in the minute, and that's cool for your patient, it's cool for you, and you can redo and control a few days after if needed. I don't speak about the vascular complication. Okay, that's not the idea to provoke any vascular complication, but looking the work of Peter Valtus and Leonie Schelke, it's very inspiring to
And
see.
Mauricio, because Mauricio belongs to the same cutaneous chapter.
So it's very
Association.
inspiring way of dealing and managing it, okay, and make a lot of pressure down so far, because you can do something in the minute you have a problem.
Yes. So I think, Sebastien, prepare your lecture now, and when you are preparing, let me know. And we have the time to speak a little bit with about the question of Dr. Wojciech Graka, who is, of course, an expert from Poland. Hello, I'm aesthetic doctor from Poland. I did facial ultrasound about 3 years in order SibUS at IMCAS Congress. When can I expect delivery? So the answer that, of course, now everybody need to know it's available for sale starting in mid-April 2025. And that's the reason we are going to organize the class I will present you at the end of this webinar, which is going to be May 24 in Paris for all European. For the Latin people, we are going to speak rapidly later. It will be in Sao Paulo. From the Middle East people, it will be in Abu Dhabi. So please, it's your turn.
Yeah.
Please, Sebastien, you can begin.
Okay, thank you. So let's talk about SibUS and ultrasound for the body. And so we're going to switch a little bit from the face. This is my conflict of interest. Relevant for it is SibUS consultant since the beginning. And ultrasound, yes, by essence, it's a game changer. Since a long time for radiologists, for sure. In our field, it's younger. The idea to get the ultrasound in our office and taking care of our patient. But what changed a lot, that's a different way of dealing the ultrasound probe. We have a lighter system, cheapest, it could be wireless. So it makes sense now to buy one and get this expertise in your practice. Just to summarize quickly, what is interesting, you have two key points to understand. Regarding the frequency of the probe, ultrasound, more frequency you get into the probe, less depth you are able to explore. That's really important. But in the other hand, more the frequency is important, better is the definition of the image you get. So for plastic surgery, mostly, if you have a Swiss knife tool, it will be around 15 megahertz up to 20 megahertz. That's allowed you to get a nice exam from head to the abdominal wall and the buttocks, for example. So telling that's these two key points are very important in order to select the system you were interested in. About ultrasound anatomy for breast, as I mentioned before, it's a dynamic exam. So it's quite easy. You can test and train yourself on you. It's quite easy to visualize in the décolleté, for example. You see the muscle moving with the pectoralis major upper. Down of it, you have the minor right here, and you have the costal arch right there with a shadow because the ultrasound are stopped by the bone. So you have no definition, you have a shadow, it's black behind the bony parts. So you will be able to visualize a different layer from the skin up to the bone in any region, mostly for in this part, in the thorax, for example. For the breast, it's quite interesting to visualize just under the dermis. In the upper part, you see more dark. This is a Cooper space ligament with some fatty tissue inside of it. And below, more glandular, more fibrotic tissue. This is a glandular scaffold. And below of it, you will see the pectoralis major. Of course, in plastic surgery, we do also breast surgery augmentation with implants, and this technology allowed us to have some clear vision on life if something is wrong with the implants. We are not radiologists, but it gave you some good indication if something is okay or not. But you're able to see and visualize with a muscle contraction. This is a case of implant below the pec major. And with the contraction of the muscle, you're able to see how bent the shell of the implant change a little bit. So you have a real dynamic exam of it. For the buttock, we know in plastic surgery it's a big issue regarding some indication, especially of fat transfer in the buttock. They face, especially in Florida, it was non-plastic surgeon doing it so far, but they face some dead people regarding this indication. So now the only country, in fact, Florida, a state of America, is mandatory to get ultrasound exam doing BBL. So when you discuss with a colleague from Florida, do they use it all the time, 100% of the time? At that moment, no, because the system on the market do not allow to get this image 100% of the time during all the procedure. Surely you're going to change with a SibUS. So what they do mapping, they control before, during, but not all the time. So it's a good option now to control before and after, and during, and control. Use the mapping in order to visualize the thickness of tissue between the skin up to the muscle, because you can have a lot of variation of the anatomy. For the abdominal wall, it's really interesting to use it, especially regarding if you have any hernia. This is you see in the middle between the skin and the muscle and the fascia layer of the rectus abdominis, the superficialis fascia. And with a cross section, you're able to see the linea alba. And if you get any problem of hernia or eventration, what else? Doppler mode in breast reconstruction for sure, in order to visualize any perforator. That's cool because you're able to target and mark where are your perforator in order to target the good skin pedal around your perforator. So nothing special, but now we have a new solution applied too. So it's easy to use it at the office too, in order to visualize some problem. For example, this mass, it was a Darrier-Ferrand dermatofibrosarcoma, for example. Well, a cyst, nothing common, but you're able to visualize the size of it. And I know sometimes some patients will complain, they get some injection. It's not only for face, it's also for buttock. A lot of time it's for buttock because a lot of patients get a lot of product inject in this zone, and you don't know really the story of the product. You don't know really what is it. So you're able to have an idea. Is it HA? Is it silicone? Is it something else? So with ultrasound, by your learning curve, you're able to know this is HA, it's okay. This is not HA, just have a look. And you see on her, it's after 3 years HA injection, and you see clearly that there's a big lump of HA in this region. You're able to make some measurements on, and if you look on the video, you see a lot of spot of HA everywhere, even in the muscle. Okay, this is above the muscle, this is in the muscle, above and in the muscle. So we have to pay attention where you are when you make your injection, and you see when you control your patient, it will change a little bit your surgical planning if you have something to do with her. And with the Doppler mode, you see in this lump, there's some perforator running it. So if you put a needle inside with hyaluronidase, well, it's not a big issue. You will get some hematoma, bruising, but okay, doing the mapping with the Doppler mode will get you safer anyway if you put something like a needle in the region. Muscular mapping this is for Dieppe, for example, by Professor Sina. So it's really and very accurate and powerful. So you can go and swipe all the body in order to target the perforator if you want to do a free flap freestyle. Now, at the OR, usually we have one hand handling the probe of the ultrasound, as you can see there. And it's already great in some way, but it's not so easy because you have only one hand to make your surgery. And as we learned since we are resident, you have two hands, so two hands, two instruments. So you need to do something with your two hands. And your contra hand is very useful in order to palpate, visualize where are your cannula, where is the feeling of the tip of the cannula, and doing the right surgery at the right time. So when you get the probe, handling the probe, you miss this information. You get the information on the screen, of course, because you are able to visualize this is a transgender patient with fat grafting in the pec major, and you see the cannula just below it. You see the pulsation of the heart with the perichondrium. And that's it. You see the cannula, and I will graft in the muscle, and you will see the fatty tissue burrowing into the fiber of the pec major. So it's interesting in some way because you see what you have done since many years. Now with the probe SibUS, as you can see, it's much more lighter because it's on the tip of the it's on the tip of your hands. And doing so, you can make your surgery easily. And this is a control for her in order because she gets some abdominal hernia. And doing so, you're able to put your cannula outside of it, of course, and not to make an injury. Again, sorry for the sound. It was post-mastectomy, immediate reconstruction with an implant. And the idea was to put some fat around the implant without injury on the implant. And doing this, you were able to visualize clearly where the cannula is, not in the implant, not too close to the shell. And you see exactly where the fat is running. In fact, that's really interesting. It's really interesting to see where is the fat. For the buttock. So buttock, the same, really interesting to see, visualize where is your cannula. The recommendation right now is to avoid to be inside the muscle, okay? So you are able to see clearly that your cannula is above the muscle. And so this is really interesting. So in post-op, the same, interesting. This is HA made by me, but you see this product was able to make some noodle in. Control breast surgery. Sometimes they can complain and get some augmentation of volume, but making your exam, you're able to see there's no seroma, post-op seroma around the shell of the implant, so you can be very happy with your patient. So it's running, and control. It's hematoma, unfortunately, post-abdominoplasty with seroma. You're able to target the zone with a needle and make your injection and aspiration in. So SibUS, to conclude, ultrasound was a game changer, and SibUS is a game changer in ultrasound so far. Why? Because it's really easy to use, and you see at the OR, I put in to enable to protect it to make sterile way. You can do it this way. You can make a hole and stick all the protection around. You put some gel on it in order to have a good connection for the quality of the image, and you put your glove in. Doing so, you're able to have natural handling of the probe in your hand and have a nice experience on the body, on the region you are making your surgery on. So you can keep it all the surgery long, okay? It was the test to see if it was working or not at the end, because for sure surgery can be long. It could be 1, 2, 3 hours. And the idea was, it was okay or not to get this probe at the tip of your finger, this all long surgery. And is it okay to use it also for accurate movement, make incision, stitches, make your surgery as you do without the probe in the tip of your finger. In fact, yes, it works. As you can see, this is for stitches. You see the probe under my finger, but so you can use the other finger for it. So this is my conclusion. So it's to conclude, it's easy, it's light, it's not like a big probe, because when you have a wireless, you have the battery in. So if you use it many minutes or 10, 20 minutes, it will be difficult for your hand and your arm to handle it because it's wet. So this one is really light, so it's easy to, you don't feel it so much, almost. So you forget it almost. So doing so, you make your surgery and you use it when you need it. So that's why for the fat transfer for the butt, now it will be possible to use it since the beginning up to the end during all the surgery, because this probe allow it. Instead the other, you can use it 100%. So this is my conclusion at that time for the surgical part.
Thank you so much. So we have, before Mauricio will begin, and Mauricio, you can set your first slide. We have a question for a colleague from United States. Is this device available in United States now? The answer is very easy. We are CE mark and we have FDA approved. So we are on a very easy way to say that yes, it will be available in the coming months. I will be in the Congress of Nashville with Brian Bessman and Michael Gold, May 14. So for any US people who like to be in touch and order the product, please be in this Congress. We are going to organize demonstration and class. So Mauricio, it's our great pleasure now to welcome you for 20-25 minutes concerning your two lectures. Number one, facial neurotoxin injection with the SibUS-In. Please, Mauricio.
Okay, so let's start this. Thank you so much again. And I am pretty excited to take you through this neurotoxin journey with the SibUS, which is pretty interesting. And I will show you why this is the way to approach facial muscles in the future. Can you hear me well, actually?
Yes, absolutely.
Okay, perfectly. So I have the pleasure to, let me see if I can continue here with my presentation. Here I go.
Yes, you
So,
click on the, yes.
Yes, I belong to the cutaneous facial ultrasound group and also to different companies that are, yes, dedicated to ultrasound-based research and also training in facial ultrasound in aesthetics, and also run my own ultrasound aesthetic academy, which is in Hamburg. And just to start a little bit about the way we use ultrasound, we know that there is a good evidence on many points. We know that understanding facial and even filler biomechanics is easier through ultrasound. We know that we can manage problems more targeted when it comes to hyaluronidase injections, when we have complications with HA, or we can also, as we have been discussing now, in order to have safer and more effective filler treatments and with better outcomes, we can implement the use, the ultrasound. And now we are, I would say, we came to the era of the finger probe. And what I would like to present to you is how to approach those fine facial muscles, which I could define as fine arts because it's really targeted little injections to the face. Why is this important? Look at this. If we talk about the neurotoxins and the market, we know that this is still experiencing a lot of growth. And it is estimated that the botulinum toxin by 2028 is going to reach impressive 10.5 billion worldwide. And Botox treatments are the most requested non-surgical procedures also worldwide. So it's a very high requested treatment. We still can have complications with this. And our duty as injectors is to perform those treatments as safe, as effective, and also, why not, as targeted as possible. And this is what I'm gonna show you a little bit. Now, if we go a little bit through the ultrasound technologies, which is really amazing to see how far we have come. In the past, these machines used to be pretty large and complex, and now we are having the power in the tip of our fingers. How wonderful is that, right? And if we now talk a little bit about the evidence on facial neurotoxins and approaching facial muscles with ultrasound guidance, there is good evidence on this. We're still in the start, but actually we have pretty much good publications about this from all over the world, including, of course, our very beloved colleagues from South Korea. And here is a little collection of all of the most relevant publications if you want to learn how to recognize, how to approach muscles, and the evidence on the safety and efficacy about this approach. So with this, we can see that it's just, I don't think that there is a more targeted way to approach a facial muscle. So now let's go to the point. I am going to treat this beautiful lady, and I'm gonna perform a full face botulinum toxin approach. Due to her anatomy and her ethnicity, I'm not gonna approach her frontalis, but I'm gonna show you how to do it. And what I'm gonna do is a treatment of the glabella, of the orbicularis oculi, the lower face, including the AO and the mentalis. And I'm gonna show you a little bit of a teaser about the masseter. So I'm gonna work with the all-in-one machine, which includes this 23 inches screen, which gives me great visibility, a big screen. And I am implementing, again, this nice curved probe, which has a foot plate of 2 centimeters long and 6 millimeters of width. Now, if you see the patient here moving, I want to reduce all of those vectors pulling the face down in the upper face and also in the lower face. And if I start to talk about the frontalis, here's a little bit of literature on this approach again. And first, I start just to see how is the anatomy in a horizontal position. Here is the right side, here's the left side of the patient. And if I play the video, you can really perfectly see when she contracts the muscle. You see perfectly the skin layers, the subcutaneous tissue, and here, this hypoechoic band-like structure, which is a muscle, and muscles look actually everywhere the same. They are dynamic, so they can move, and at the moment of a contraction, you can even see the suprafrontalis, the subfrontalis fascia, and here, beautifully, the bone. And if we change our position, we can see here the other way where the frontalis is contracted. Here's the epidermis. You see here the wrinkles. You see the layers of the dermis. And here you see the bulging subcutaneous tissue. And my muscle is actually pretty deep, just above the bone in this perspective. Look at this again. Contraction, movement. How beautiful can you see here the bone line? Really defined and crisp and pretty good. And this is another patient. I am approaching here my frontalis muscle. I want to inject at this point deep, and I am approaching here the muscle in the so-called out-of-plane technique, which is coming perpendicular to the short axis of the probe. That is the difference between the out-of-plane and the in-plane, which is going along the long axis of the probe. So if I play the video here, you perfectly see where my needle is. Let me go back. Here is the insertion, the aspect of my needle that I can see in this perspective. So I am in the deeper planes, and then I know where I am in, and I do my injection of botulinum toxin, 1 to 2 units in a normal reconstitution. And you see how the tissue bulges a little bit, and that's my inoculation of botulinum toxin for the frontalis. That's how I approach it normally. Then let's move on to the glabella. Also very nice area. And here you see a prospective randomized study comparing ultrasound approach against the normal conventional approach. And they were able to demonstrate that we can have a quicker onset of the toxin and even have better outcomes at the end using ultrasound compared to the blind approach. And here, just for your demonstration, I put my probe in a vertical perspective here, the deeper layer, hypoechoic and band-like structure contracting. Here is the bulging fat. And if I change to the corrugator muscle, that muscle is much deeper. Here's on the right side and here's on the left side. And you can even appreciate on this side, wait a little, I see here my supratrochlear foramen where the vessels are crossing. So you let the patient contract, you identify your target, you know where you have to go, and then you just come. I use for this patient a 30 gauge needle, and I am working, as I said, in the in-plane injection technique, coming along the long axis of my probe. So here's my needle. My needle is coming here from this side, and here I just injected my needle. Here I am deep. I can see the movement where I am making my inoculation of botulinum toxin. And if I go then to the one side of the corrugator here, you see, here's exactly the tip of my needle. There you go. It's actually pretty easy to see. I am intramuscular and then I do my injection. And here even, you can see it even better. There you go, this hyperechoic line approaching this hypoechoic dynamic structure is the muscle. And I inject about 4 to 5 units on each muscle. And I do it here in a 1-to-1 reconstitution. And I need actually less because I just only do 3 points injection. I don't need to go laterally. Now, then moving on to the, let me see if I do, yes, it works. The orbicularis oculi. I like to inject this muscle actually in a subdermal plane. Sometimes it's good also to inject intramuscular if you want to have a stronger effect, but sometimes this can look a little bit unnatural. So here, I approach just to see the anatomy of the muscle. I let the patient squeeze the eyes, and here you see the muscle contracting, thickening, and here is the hypoechoic band-like structure just above the subcutaneous fat. And if I want to go to that area, I approach the muscle most of the times also in an out-of-plane technique. Here's my needle, there you go. And then you see, here I'm just above the frontale, above the orbicularis fascia. Here's the muscle, here's my needle, I am in the subdermal plane. And then you see the tissue expands a little bit after injecting the botulinum toxin. Pretty easy to see. And my patient is not going to get a very strong paralysis of the muscle and will look more natural. And this is actually the way that our colleagues from Korea are also recommending to approach the orbicularis oculi muscle in order to improve the crow's feet. Again, you can also inject intramuscular if you want, and you can also visualize that pretty nice using this machine. Now, moving on now to the lower face, I really enjoy injecting lower faces because it has a nice impact on patients that tend to get a lot of tension around the mouth. And if you see, let me just go again back to the depressor anguli oris muscle. Here is the modiolus, or I am towards the modiolus here. You see the muscle insertion on the mandibular bone. And if I ask the patient to move, there you go, it contracts. Here you see it. It's actually pretty nice to detect, and I approach again the muscle in a inline injection technique. I go just below my probe, and here I am inserting the needle. I am there exactly, and inject about 2, maybe 3 units in a 1-to-1 dilution. And just have a look. We actually inject when we don't use ultrasound in the same way. So I am not really changing a lot about my injection process. I am just using my probe on my finger and adapting to that and making the muscle just visible for me. So also a very nice advantage of approaching the musculature in this way. mentalis muscle, you see it here as a very bulky muscle. It's deep. It comes from the bone at the area of the labiomental crease and goes towards the chin apex and inserts in the subdermal plane. And when I just, here it is, you see how the muscle changes and contracts and makes sometimes a pupil chin, irregularities on the chin. And just have a look again. I am just coming with my 30 gauge needle. There you go. Here it is. Here it is. And I am just on the muscle here. And then I can inject my 2, even 3 units of botulinum toxin. Now, if we talk now about the masseter, I like to actually dedicate a little bit more of time to this because this muscle is much more complex than we think. The masseter has different compartments. The masseter shows also different deep inferior tendons. You see it here during the contraction, and that tendon actually divides the muscle in different areas. So if we inject botulinum toxin in an uneven way, maybe when this tendon acts as a barrier, we're going to have changes in the dynamic, maybe causing also this paradoxical bulging. And there's actually a lot of evidence on the ultrasound approach for the masseter muscle, which summarizes that you need actually less units and you really work on the areas of the muscles that are hyperkinetic, so that are very strong. And the only way to see which pattern of deep inferior tendon my patient has is to use the ultrasound. There is no other way. And this is just a teaser again of how I do my injection position. You see me here in front of my patient. In front of me is my screen, and here is the way how I approach this muscle. But again, I think to the whole masseter and lower face, we could dedicate something separately. But look at how nice the anatomy looks like. The bone line is really sharp and defined and great. And you see here the muscle contracting. Now let's have a look to the patient. This is the patient before, this is the patient just 3 days after the injection with less units that I usually use. And look at that. She's already having almost the entire effect. I expect to have a little bit more the next days, but she's already pretty good with her result. All of those vectors that I wanted to reduce are reduced. She cannot frown, she cannot pull down, and looks actually younger at this point, just 3 days after the injection. So, and now my take-home message is ultrasound, if we use this when we inject into facial muscles, we are going to have more precision and safety. We're going to be able to visualize our key structures. We can, with this, treat our patient in a tailored mode. So we really adapt according to their own anatomy, because we are all different, we know this. And we're going to achieve a faster wrinkle reduction. You're precise injecting the muscle, and patients, they're actually happier. They have also the feeling of being in a very professional, serious environment. And this is actually a very important point. And with this, I would just want to take 1 second to invite you to our first International Summit on Ultrasound-Guided Aesthetics on January 28th, just before IMCAS. We are happy to announce that we have a great scientific committee, a great program, and this is going to be an opportunity for you to get your hands not only in different devices, but also on the SibUS, try new injection techniques, see how that works, see the pits and pulls of all of the process, and learn just about these technologies if you are interested into integrating this into your daily practice. And with this, I am now done with my first presentation, guys. I hope you... Here you go. Do we have questions? Are you hearing me?
Yes, I think we need to go to your second lecture because we need to stay in time. Thanks to Hugues Cartier, we just arrived from the practice, and we are going to chat a little bit with Hugues at the end of your second lecture.
Okay, so then let's continue this ultrasound and SibUS journey. Now I am talking about how to select. This is actually a very tricky thing sometimes. Now, when we want to see and we want to integrate these technologies into our practices, you can be pretty overwhelmed. I was overwhelmed 7 or 8 years ago when I started doing this. I just didn't know where to go, what to use. And there is so much stuff outside and around. We have those high-end machines, we have the mid-range machines, we have the portable devices, and now this wonderful tool to use with our finger to be so handy and practical. But at the end of the day, we just have to know what are we comfortable with. And this is just a little example of 4 deep piriform spaces with different probes. So this is just a little bit of a test for you guys to see what do you like the best, because this is actually the same area. And you see that they are all kind of comparable, right? So here I am using a 50 megahertz high-end device and a very higher price of the range. Here I'm using a mid-end device. Finger probe, 50 megahertz, our SibUS. And now if I want to have a look into the Doppler mode, it's a good possibility to compare, right? This is the first device again, one handheld device, 10 megahertz, a mid-range device, 20 megahertz. Here's the finger probe, again, nice visualization of the vessels prior to injection. And this is just an example of a very high-end device with 3D possibilities. So when it comes to deciding what you're going to do, what you're going to choose for your injections, you have to consider 4 different points. And the first one is, what is your main objective? Are you an aesthetic physician? Are you interested in just do ultrasound-guided injections, vascular mapping, dissolve filler, see the layers where you're working? Then it's actually okay and pretty much sufficient to work with a finger probe or with a probe just between 50 megahertz, 20 megahertz. On the other hand, if you are a dermatologist and are also having a look into more superficial areas, the epidermis, tumors, inflammatory diseases, well, you will need probes that actually are more on the range, just between 30 to even 100 megahertz and more. And those kind of frequencies are only possible right now with those high-end devices. So it's important to see where you come from. And just Sebastien could really demonstrate how great to work on all of the surgical indications with this very practical finger probe. So the high-end devices, they have, of course, pros and cons. Of course, they have bigger screens, which we also have with the SibUS. Actually, you have more advanced processors and higher frequencies, but are on the higher end of the price list. And they are actually not easy to move. So the portability is really not given. So typically you use this in big clinics or hospitals where you see a lot of volume of patients. Now this is just a little group, an example of the mid-range devices. And they're also nice. You can also have different probes, multiple probes. They have a amount of battery that is also nice, and you don't have a lot of extra costs with that, but still they are kind of expensive. They are not wireless. This could be also a disadvantage, let's say, and the internal storage is not as much as you actually would need if you see and use these machines every day and you treat complications as well. Then we have the handheld devices. Dr. Ascher just talked about all of this. There is a lot of advancement in these, even where voice commands, AI help us, but those devices can be very bulky, as we said. They don't have a good battery time, so you need to recharge that very quickly. They overheat. You have to buy sometimes even an extra fan. And if you're using this all the day, this is going to be exhausting and painful for your wrist. So, and sometimes you have constant updates just before you want to do the examination, then you have to do another update and another update, and this can just be a little bit of time consuming. So having this, we have some limitations, and giving or based on these limitations, because we know that those devices were not really adapted for aesthetic injections or plastic surgery. We have these linear and rigid transducers, and sometimes we even have to use our both hands, one hand for the device, the other hand to operate on the screen. And this can take just so much time. And this is actually the nice thing about this finger probe, that it's practical, handy, it's very light. You can use it hours and hours, and you don't even feel anything about bulkiness and heavy. What I really enjoy is when I inject my biostimulators, you can use the other fingers, you can lift the skin, you can stretch the skin, and still have the probe in your hand ready to use. So, and this is a little bit of a summary on the SibUS. We have a great image quality, you just saw that. And actually, we are also working on this for you to have a even more rapid learning curve. So it's going to be easy to see how the probe has to be positioned for a respective injection. And again, you're going to be able to have more freedom for your hands. You're going to be able to not have, you know, this kind of fatigue on your wrist. You're going to be able to visualize vessels in a pretty good way. For the nose, it's really nice. I am really enjoying the Doppler mode with this. And again, you're going to be very targeted, very precise at the moment of doing any kind of injection, not only botulinum toxin, as I just showed you before. And here are the versions that we had in the past, and now we're working now on this all-in-one device with or without the trolley, which also has a better performance in order to make it more portable. And if you just want to take it somewhere else, then you can have the other version of it in order to move and take it easy. So, of course, the shape and the footprint of the probes is important. We have recommendations from different societies dedicated to ultrasound, and here is again the SibUS probe being the first curved probe to be able to use for all of the concavities and convexities of the face. Another point which is very important is the storage. Find something to storage your images and videos, because you're gonna collect a lot. And the recommendation is just to use high capacity external hard drives or PAC system or a cloud system. And another point, and this is the fourth and last one, technical service and application specialist support. It's so important to have a rep in a company that is reachable for you when it comes to, you know, settings, or when you try the device for the first time, if you have difficulties understanding something. This is actually pivotal when you buy a machine like this. And in my opinion, what should I use? Define your main goals, okay? And then just go and do one training for beginners, learn how to make the anatomy visible, try different devices, practice for some years, and then go back and do an advanced training. So this is a journey. This is a journey. But I think that with the finger probe, it's going to be actually easier, because you're not going to change your technique about how you inject. Of course, practice, practice, practice. And at the end of the day, it's the best ultrasound that you can use and choose is the one that you take in your hands and implement and use every day. And with this, I am done with my last presentation, guys. Thank you so much.
Thank you, Mauricio. It was absolutely clear. We have so many debate and chat, and we encourage everybody, of course, and but we need to respect the time. So please, could we ask Hugues Cartier to be with us just for the last conclusion? And we are going now to go to the conclusion, if it's possible. So let's go concerning the final set of slides. And I would like just to go to the market. So I think it's important that you understand that we have demonstrated that now we could have quite a good amount of market analysis dedicated to the fact that it will be promising on the coming years. And you can see now that the projection, definitely North America is going to be the most important, but the projection in 2024 seems to be quite interesting. 2025 will be a little bit bigger. And now you can see how it's work. Mainly, it will be on the hands of the aesthetic practitioner, but concerning the fact that we would like to teach, we go first to the core people, the dermatologist and the plastic surgeon. And it's my great pleasure to invite you to the VIP class through SibUS Academy membership. You need to be member with the fact that you need to have a machine. And I think we are going to invite you with Mauricio, with Sebastien, with Audrey to this class, which is going to be in 1 month, May 24 in Paris. And we are now ready to share with you what is the capability of the SibUS-In.com. So please go to SibUS-In.com. You have, of course, a very nice mobile translation of this website, and you will see all resources, the video, you can chat, you can ask questions. We are ready to use. And just to terminate, that's just a little bit of Peter Veltris, who is going to say some few words.
It's not a separate machine. That makes it so easy to use, because otherwise you have something in your hand, and it acts like the same type of machines as we've been adjusted to. So I think it's a great new tool. And then of course there's the additional advantage that it's probably easier to go in there with your needle. So I think it's a fantastic step forward. So now we see.
So we need to respect a little bit the time. So just to let you know how a company, a little startup, begin in 2021. And after 3 years, we are CE and FDA approval. So it's not so bad. And it's a great pleasure to present you all the US, the Korean and the European key opinion leader who belong to the most part of this segment. And we are now on the board of SibUS. So I would like to have, just in a conclusion, Hugues, who is the course director, one of my 2 course directors of IMCAS. He will be with me tomorrow morning in the flight to Sao Paulo. We are going to speak about the class in Sao Paulo just in a while. So please, Hugues, why you think that SibUS-In is promising?
When we start doing IMCAS to begin in this field, ultrasound, and Benjamin say, I have a new idea, I was a little afraid, but this idea, saying, you're sure? And that he says that because we use, I'm phlebotomist and dermatologist, and I use ultrasound since many years, and the idea to inject, it is a fault of Peter Veltris and Neil Michalke more than 5 years ago, but we say that to handle the device in your hand, it was not so easy. So Benjamin said, because he's plastic surgeon, he said, we need to find something to simplify our life, okay, or your practice. And he said, what we cannot create just a finger probes. And he said, why not? Is it possible? So the challenge was very high because we have a lot of competitors, but this idea was very in rupture what we can find on the market. And, you know, to keep your hand free, to have a third eye as any other device, but you have one thing more very important for doctor who are making injection, that you have the figure, you can touch the skin, so you feel the skin. It's not so far away from the probes you have, so you can remove your probe, you can see what you want. It's really interesting. So it's not necessary to keep your probes all during your injection. You can elevate your finger to see what you want, where you want, and you can apply again and to see the migration of our product. And I love the video of Mauricio, because he knows that how I believe that to inject filler with ultrasound is very now for us, it's a mandatory, it's very common, but to inject for the muscle, to be more precise, to spare unit. Okay, we can say maybe you are completely silly because it's so easy to inject toxin. But with that, you are more precise. You make the difference. You make the break if you compare to other colleagues. And it's so funny to use for muscle. And with this finger, it's easy. If somebody says the learning curve is very important, I say no. To see a muscle below the skin with this kind of device with the SibUS, really, it's not so difficult. It's not difficult. So I encourage you to try this device because it's for my brain, it's a hand of my hand, So it's not so difficult. It's more difficult for somebody who use classic platform, classic ultrasound since many years. But for a beginner, it's tactile. It's very important for that. And I believe it could be maybe more easier to handle for a practitioner who don't use ultrasound in daily practice with this new device. And we were very surprising because we have a big view below the skin, beneath the skin, with a small probe. It's only 2 centimeters. It's nothing. So it was very good surprise, but you cannot imagine how it was a long way to obtain this kind of result. It's really crazy, really crazy.
Nice journey.
Yes, it's very interesting. So it's not for us, but it's for all of you guys, women. You can use it, but the most important is to trust us and to use it.
To exercise. So, Mauricio, you will be with us in Sao Paulo. And of course, we are going to run a SibUS class, which is going to be April 11 during IMCAS and IMCAS Sao Paulo. Then you will be with me for the SibUS-In class Abu Dhabi, which is going to be May 4 and 5th in Abu Dhabi. And we are going to run a very smart SibUS class with hands-on, of course, anytime big hands-on. And it will be, of course, our great pleasure. And last but not least, we are going to be in Paris, May 24, for this class dedicated to all practitioners who would like to be on the purpose to have the acquisition of this machine. So please stay connected. I hope that you have enjoyed this first introduction of SibUS. And I would like that you say a little hello, Mauricio, just at the end, and Hugues as well. Mauricio.
So guys, it was a pleasure to be here, and I am really excited about this journey that is about to come for us to experiment and to just see how this wonderful tool works for us. This is gonna make everything easier, I think. I'm sure.
Hugues.
Yes, trust us, be involved in this new field, ultrasonography. And with this device, you are in rupture if you compare to other you can find on the market. So it's so interesting. And I believe after that, you will like to use in every day in daily practice and to have a discussion, but we all together. With smart interest, we prove that we can put some science in aesthetic field. We can prove what we are doing in every day, not to say to use a blind technique. We are in another area for us, and it's most important to save your patient and to make the follow-up of your patient also is very important. For the product you inject, for the product are injected by other colleagues, and for toxin is more fashionable, is more trendy. I love to inject toxin with SibUS is very, very interesting. Okay, see you soon, everywhere.
So stay connected on SibUS-In.com, SibUS-In.com. We are so happy to have you as a great community. Thank you, and stay with us, and have a very good evening.